After deciding on style, in order to be able to perform this song perfectly, we have to work hard in the following parts. To begin with, imagine that you have some bad news, such as a relative has just died or you have just failed some exams, and then you decide to share this information with another person. Think about the factors that would help you to begin to share the information or would hinder you to sharing the information. Okay, let me guess what comes to your mind. First of all, the setting or situation is clearly important. You are unlikely to discuss how you feel if the conversation takes place on the top of a bus or in a crowded room, aren't you? Secondly, how you feel at the time will influence what you say, and so will the attitude of the other person. I think you are more likely to be able to share information and to find the process helpful if the other person is friendly and attentive. So, the following three are important for starting a comfortable conversation: setting, doctor-related factors, and patient-related factors. Most consultations take place in a hospital ward, the outpatient clinic, or the general practitioner's surgery. In each case, every effort should be made to provide a setting that facilitates communication. Privacy is essential. A patient in a hospital bed is unlikely to divulge personal, sensitive information if she knows that Miss Smith in the bed next door can hear every word through the curtains. If you do not feel that the setting is right, try to find an alternative, providing, of course, that the patient can be moved. Try to avoid the interruption and make sure that the lighting and the temperature are as comfortable as possible. It is important to consider the arrangement of seats. They can influence how people communicate with each other and may give clues to how they perceive their one and each other's role in the encounter. In the outpatient clinic or general practitioner's consulting room, where there are usually chairs and a desk or a table, there are three possible ways of arranging the setting. Arrangement A, with the patient and the doctor facing each other across the desk, is unlikely to make the patient feel at ease or facilitate discussion, although the doctor may feel in control of the interview. Arrangement B and C are more informal and more likely to facilitate good communication. Another point to consider is the distance between the doctor and the patient. Placing seats too close together may make the patient feel threatened, while too far apart may convey a feeling that the doctor is not interested in what the patient is saying. Most consultations take place at a distance of 1.25 to 2.75 meters, although the distance may change during the course of the interview. For example, as a doctor, you might draw your chair closer to the patient when offering reassurance. Interviewing a patient who is in a hospital bed deserves special consideration. Standing over a patient is likely to increase the patient's feeling of vulnerability and should be avoided. It should always be possible to draw up a chair so that you are on the same level as the patient. People cope with illness in different ways depending upon their personality, upbringing, social class, ethnic and cultural background, and their life experiences. These factors will influence how they communicate. Reactions to illness include denial, anger, anxiety, and depression. These responses will determine if and when a person seeks medical attention and will also influence a patient's behavior when receiving care. Most people experience a degree of anxiety and apprehension when consulting a doctor. In particular, admission to a hospital is a disturbing experience for most of us. Factors that contribute to our anxiety include an unfamiliar environment, loss of personal space, separation from family and friends, loss of independence and privacy, and uncertainty about diagnosis and management. Thus, individuals' physical condition and their psychological states related to both their illness and the medical care they receive will influence the communication process. As we shall see later, it is important to identify and seek to overcome patient-related factors that may impair communication. I have listed common patient-related factors. Please read and remember. Some medical students and doctors find it easier than others to empathize and communicate with patients. Although, as we have already noted, these attributes can be acquired by training. Following factors influence our behavior during a consultation. As a medical student, you may initially find it difficult when interviewing patients who are much older than yourself, particularly when sensitive issues such as sexual behavior are involved. It is not difficult to understand why a medical student just before finals, a junior doctor at the end of a long shift, or a general practitioner who has already seen 24 patients earlier in the morning may have less to give a particular patient. Tiredness, anxiety, and preoccupation with other concerns are all likely to impair communication, and we need to be aware of these limitations. We also need to be aware of our own prejudices and take care that they do not interfere with our communication with patients. For example, a patient who persistently presents with symptoms that do not appear to have a physical basis must be taken seriously and must not be dismissed as a hypochondriac. When we are ready now, how do we begin an interview properly? The way in which we begin a conversation can have a profound effect on what follows. The aim in a formal setting should be to make the interviewee feel at ease. How can this be done? Think back to a formal interview in your own experience. How did you feel before and during the interview? Did anything help to put you at ease? If so, what? Did anything make you feel uneasy? If so, what? What would have been changed to make you feel more comfortable? In describing what made you feel at ease, there may be a comfortable sitting, be greeted by name and a handshake, be shown where to sit, the interviewers introducing themselves and explaining the procedure. An easy first question, the interviewer appearing interested in your remarks. Unfortunately, interviewer may neglect some or all of these strategies, and doctors are no exception.
Mrs. Francis, a shop assistant aged 31 years old, attended medical outpatients at her local hospital. Here is her story. When I went into the hospital, which was crowded, I felt lost. Doctors and nurses had their heads down and was concentrated on their own work. I waited around and wanted to run out the door. After what seemed like ages, and the doctor told me to sit down and asked what was wrong. I didn't know his name, and I'm not sure that he knew mine. I had been thinking about my problems and what I wanted to tell the doctor, but I forgot it all. He didn't seem very interested anyway. Hope I don't have to go again.
An unsatisfactory beginning is likely to lead to an unsatisfactory consultation, as the following case illustrates. It is not difficult to spot what was wrong with the way this interview was conducted. By following simple rules, you can help patients feel at ease, and you can begin to build up a relationship that enables your patient to share the story of their illness with you. Beginning the interview involves greeting the patient, introduce yourself, and orienting the patient. Much of the doctor's behavior is simply common sense and courtesy, but this may be easy to forget or ignore, particularly when time is short.